That strange feeling of déjà vu. Explained, memory, brain health, and when to worry. Welcome back to Vital Signs, your trusted source for health and wellness insights from American Family Care Joplin. Have you ever had that eerie feeling of déjà vu, where a moment feels like you've lived it before? It's a fleeting sensation that affects up to 97% of people. But what causes it? And could it be a sign of something more? Today, we're diving into the science of déjà vu, its links to brain health, and when you should talk to a healthcare provider. With expert insights from Clinic Director Reilly Allmoslecher, let's unravel this memory mystery and explore what your brain might be telling you. Stick around for health tips to keep your mind sharp. Déjà vu, which means already seen in French, is a false memory, a sensation that you've experienced an identical situation before, even though you haven't. Reilly Allmoslecher, Clinic Director at American Family Care Joplin, explains déjà vu is a false sense of familiarity. Your brain creates a sensation as if you've been in a certain situation before, but you haven't. It's usually a quick moment that makes you pause, then fades. But sometimes, it could signal something worth checking out. Let's explore what déjà vu is, why it happens, and when it's time to see a healthcare provider. Picture this: you're chatting with a friend, and suddenly, it feels like you've had this exact conversation before. Or you're at a coffee shop in Joplin, and the scene, other customers, the vibe, feels oddly familiar, like you've lived it. Maybe you visit a new place, but the layout or a scent triggers a sense that you've been there. Reilly Allmoslecher notes, there's usually an incongruence between having this sense of familiarity, but also knowing the situation shouldn't feel familiar. That's déjà vu, and it's your brain playing a fascinating trick. So, what causes déjà vu? Reilly Allmoslecher says, déjà vu is caused by dysfunctional connections between the parts of your brain that play a role in memory recollection and familiarity. It's like a misfire in your brain, specifically between the temporal lobe, which handles memories, and the hippocampus, which processes new experiences. When these two areas miscommunicate, your brain blends memories and new information, creating a false sense of familiarity. As Reilly puts it, memories and new experiences get wrapped up in each other. Some people may be more prone to déjà vu if they have a high level of education, travel frequently, or remember their dreams. While déjà vu is usually harmless, certain health conditions can make it more frequent. Let's look at a few. Fatigue or sleep deprivation. Not getting enough restful sleep can disrupt your brain's recognition processes, making déjà vu more likely, especially in the evenings. Stress and anxiety. During stressful times, your brain may alter how it processes information as a coping mechanism, increasing déjà vu episodes. Migraines. If you're prone to migraines, déjà vu might occur during the aura phase or the migraine episode, as pain can disrupt memory processing. Dementia. Frontotemporal dementia can cause persistent déjà vu, with individuals trying to rationalize the false memory. Temporal lobe epilepsy. Seizures in the temporal lobe can trigger déjà vu without the dramatic shaking you might expect, as Reilly explains. Seizures restricted to the temporal lobe can cause a misfire that creates the feeling of déjà vu. Most of the time, déjà vu is nothing to worry about. It's a quirky brain moment that happens a couple of times a year for healthy people. Reilly confirms déjà vu is an occasional phenomenon in healthy individuals. But if it's happening often, lasting longer than a few seconds, or paired with other symptoms, it's time to talk to a healthcare provider. Watch for red flags like confusion, headaches, loss of awareness, weakness, seizures, or shaking. These could point to neurological conditions like epilepsy or dementia, and a neurologist can help get to the root of it. So, when should you seek help? If déjà vu feels frequent or disruptive, don't ignore it. Reilly Allmoslecher advises, if it happens often enough to make you wonder, it's worth talking to your provider. At American Family Care Joplin, our team can assess your brain health, review symptoms, and refer you to a neurologist if needed. Whether you're in Joplin or nearby, addressing persistent déjà vu can protect your mental health and overall well-being. That strange déjà vu feeling is usually just your brain's quirky way of processing the world. But don't brush it off if it feels off. Visit American Family Care Joplin at 320 South Geneva Avenue or call 417-526-4232 to get checked out. That's all for this Vital Signs episode. Comment below. Have you ever had déjà vu? How did it feel? Subscribe and hit the bell, and join us next time for more health tips to keep your mind and body thriving. Stay curious. If you are feeling under the weather, you can walk into American Family Care Joplin 7 days a week with no appointment to get a diagnosis. We will have you feeling better and back on your feet fast. IFC Urgent Care Joplin, located off 3rd and Rangeline behind Starbucks. American Family Care, the right care, right now.